My name's Max Feinstein, and I'm an anesthesiologist with the Anesthesia Patient Safety Foundation. I say the word anesthesia every day, but even if it doesn't roll off your tongue easily, it's an important topic if you or a loved one are planning on having surgery. Let's talk about what anesthesia does to the brain during surgery and what you can expect after. We'll talk about what we know, what we're still researching, and how anesthesiologists work as part of your care team to lower risk during and after surgery so that you feel informed and part of the care team to ensure your safety. So, what exactly does anesthesia do? Anesthesia involves one or often multiple medications that help you be unaware, like being in a deep sleep, and feel no pain during surgery. It helps turn the volume down on parts of your brain so that you don't feel or remember the operation. After surgery, the medicine wears off and the brain turns back on. Your care team watches your brain and body closely while this process happens. Patients report a wide range of experiences after receiving anesthesia. Some don't notice any effect after the surgery, while others have notable experiences. Today, let's discuss some of the possibilities that may affect you. Let's start by talking about delirium. Delirium is a sudden change in the way a person thinks and pays attention. People may feel confused, sleepy, or even see things that aren't there. It can come and go over hours or days after surgery. Your care team may use quick bedside tests like the Confusion Assessment Method, or CAM, to check for delirium. Delirium is not unusual in people after surgery, especially older adults. Delirium can slow down the recovery process and make a person have to stay in the hospital for longer, so we work hard to prevent it. Some people also notice mild thinking or memory trouble for weeks after surgery. Health experts may call this post-operative cognitive decline, or in newer terms, perioperative neurocognitive disorder. Most people do improve over time. Your team may use simple memory tests before and after surgery to track this. Risk for delirium is high if you are older, have many medical problems, take many medications, or have had delirium before. Longer surgeries also raise the risk for delirium. These findings all come from a large research study that combined the results of many other research studies. For older people having heart surgery in particular, risks are higher overall. Older age, depression, irregular heart rhythms like atrial fibrillation, diabetes, and longer time on the heart-lung machine can raise the chance of delirium. We are still researching if and how people's brains may be affected by the environment that surrounds them, any medical conditions they have, as well as other factors like the medications they take, including medications that are used as part of anesthesia. Before coming back to the operating room for surgery, your team may ask simple questions or use short tests to see how your thinking is doing at that time. This helps us spot people who might need extra help after surgery. Generally speaking, a longer surgery usually means more stress on the body and brain. A large study that pooled together patient data found that a longer time in surgery or under anesthesia was tied to a higher chance of delirium. There isn't one best type of anesthesia for every person. Sometimes we can use a technique called regional anesthesia, which means numbing a specific part of the body. Other times we need general anesthesia, which means completely unconscious and not aware of anything at all. Taking into consideration age-related changes like frailty, cognitive impairment, and current medications, your care team will pick out the safest anesthesia plan for your surgery and health. Major studies show that both approaches, regional and general anesthesia, are reasonable, and that the safety depends on the patient and the procedure. The goal is always to use careful preoperative assessment to make an anesthesia plan that will decrease the risk of postoperative complications like delirium. General anesthesia is commonly achieved with an intravenous medication called propofol, where the IV is typically placed in the arm. Another common way of achieving general anesthesia is with a medication that's inhaled. The common medications that are used are isoflurane and sevoflurane. Researchers have wondered whether the intravenous approach to general anesthesia or the inhaled medication approach to general anesthesia is better than the other for reducing the risk of delirium. To that end, what we currently know is that either intravenous or inhaled anesthesia is acceptable for general anesthesia in the older population. There is no conclusive evidence at this time that one strategy reduces delirium compared to the other. Certain relaxing or sedating medications can sometimes add to confusion in older adults. One of the medications of concern is called midazolam, which is also known by its trade name Versed. Many teams now use the lowest effective doses or avoid them altogether when possible. Now let's talk about depth of anesthesia. We don't want anesthesia that's too light or too deep. Some hospitals use a small brain monitor sticker. This is called a processed EEG. This is one strategy that we can use to help keep anesthesia in just the right range for a patient. We generally try to keep your blood pressure close to its usual level during surgery. This helps to make sure that the brain gets enough blood and oxygen. With some exceptions, we typically try to keep blood pressure within about 20% of what it normally is. So how can we prevent and identify delirium? We have many different strategies available, and those include making sure that pain is adequately treated, making sure that glasses and hearing aids are with patients or at least at their bedside, helping to make sure that patients get adequate sleep while they're in the hospital, and making sure that patients get up and moving, which can help avoid delirium. We also try to avoid or reduce giving drugs that can trigger confusion. Healthcare professionals also screen for delirium so we can help quickly if it appears. Family members can play a very important role in preventing and navigating delirium. For example, family members can be especially valuable for reorienting patients when they return to their hospital room from surgery or a procedure. They can make sure that a patient has their hearing aids on and glasses available. They can also ask how they might help keep their loved ones mobile, which is an important way to prevent delirium. Family members, especially if they know the patient well, might pick up on earlier signs of confusion and delirium. It's really important to share these early concerns with the care team. Patients with delirium may have erratic behavior that's concerning, such as pulling on tubes connected to their bodies after surgery. It can be helpful to discuss with your loved ones and care team the options that are available for managing behaviors if you have delirium after surgery, sometimes including temporary restraints. If you're having heart surgery, we pay extra attention to mood, heart rhythm, blood sugar, and how long the heart-lung machine runs during the surgery. These steps can help lower the risk for delirium. The bottom line is that most adults do very well with modern anesthesia. Some people, especially older adults, may feel foggy for a few days after surgery. A smaller group gets delirium, which we can often prevent or treat to keep it short-lived. Picking the right anesthesia plan, watching anesthesia depth and blood pressure, and getting you up and moving all help to protect your brain. If you or your family notice confusion after surgery, tell your care team right away so that they can help. If you have any questions or concerns, don't hesitate to ask your care team.